Welcome. Today we're breaking down amyotrophic lateral sclerosis, or as most of us know it, ALS. You've definitely heard the names, right? Lou Gehrig, the Iron Horse of baseball, the brilliant mind of Stephen Hawking. These are giants, linked forever by a single, complex condition that many of us have heard of, but maybe don't fully understand. So what is it really?
To really wrap our heads around this, we're going to break it down. First, we'll define what ALS actually is. Then we'll trace its journey through the body. We'll dive into the puzzle of what causes it, look at how it's managed, and finally, talk about the reality of what it's like to live with it.
So, what is ALS? At its very core, you can think of it as a fundamental breakdown in your body's internal communication system. It's a disease that goes right after the very cells responsible for controlling every muscle you move.
Okay, so the official definition is, well, it's a mouthful. But here's the key. Think of your nervous system as an incredibly complex electrical grid. The motor neurons are the wires that carry the messages from your brain out to your muscles, telling them to move, to walk, to speak, to breathe. ALS is what happens when those wires start to degenerate and break down. The messages get silenced and the muscles are left without commands.
Now what's really fascinating here is the distinction between two sets of these wires. You've got your upper motor neurons in the brain and your lower motor neurons in the spinal cord. And ALS is so devastating because it damages both. And here's why that matters. When the upper neurons are damaged, it causes muscles to become stiff and spastic. But when the lower neurons get hit, it causes weakness, twitching, and muscle lossing. It's the same disease, but where it strikes first determines the symptoms.
And this table here, it just lays that out perfectly. You can see how that specific damage defines the main subtypes of the disease. Classical ALS, that's the most common form, and it involves the breakdown of both upper and lower motor neurons. But you have other, rarer types where only one or the other is affected, and that leads to different symptom profiles right from the start.
So let's move from the cellular level to the actual human experience. How does this disease build? How do the symptoms emerge and then evolve over time?
You know, the beginning of ALS is often incredibly quiet, almost deceptive. It doesn't usually start with a bang. It could be something you just brush off. A little twitch in your arm, maybe you start tripping over your own feet, or suddenly fumbling with your keys. It's so subtle, and it all just depends on which of those motor neurons are the first to be affected.
So that means the disease usually reveals itself in one of two main ways. Limb onset is the most common path. It starts in the arms or the legs. But for about a quarter of people, it's bulbar onset. And that's totally different. The very first signs are changes in speech or difficulty swallowing, which presents a whole other set of challenges right from the get-go.
The progression of this functional loss is actually tracked with something called the ALS Functional Rating Scale. It's a way to measure abilities like walking, speaking, and breathing. And while every single person's journey is unique, on average, patients lose about 1 point on this scale per month. It's a stark, measurable marker of that steady decline.
And this is such a critical detail, and honestly one of the most poignant aspects of ALS. While all of that voluntary muscle control is being lost, a person's awareness, their ability to see, hear, smell, taste, and touch, it all remains completely intact. The mind is essentially locked inside a body it can no longer command.
Which brings us to the biggest question of all. Why? What causes this devastating breakdown? And the truth is, the answer is still a very, very complex puzzle.
If you look at this chart, it tells a huge part of the story. The vast majority of cases, we're talking 90 to 95%, are classified as sporadic. That's just a medical term that means there's no known family history of the disease. It appears, seemingly, at random. Only that small fraction, just 5 to 10%, are familial, meaning they are inherited.
Now, for those with that familial form of ALS, specific genetic mutations are the direct cause. Researchers have identified over 40 genes that can be responsible, but as you can see here, just 4 of them are the culprits in nearly half of all inherited cases. Many of these genes are involved in critical jobs inside the cell, like protein recycling. When they're mutated, that process breaks down, toxic junk builds up inside the motor neurons, and that ultimately kills the cell.
So what about everyone else? The 90+% with sporadic ALS? Well, the leading theory is that it's not one single thing. It's more like a multi-step process, a kind of perfect storm, where a person's underlying genetic susceptibility interacts with environmental factors over the course of a lifetime to finally trigger the disease.
So with no cure yet on the horizon, the entire focus of treatment has to shift. It's no longer about cure, it's all about care.
And that is the fundamental philosophy of ALS care today: comprehensive, supportive management. The goal is to use every tool available to help patients live as fully as they possibly can for as long as they can.
And this isn't a job for just one doctor. It takes a whole team of specialists working together. They use medications to try and slow the disease down. They use breathing support to improve quality of life and survival. You have physical, occupational, and speech therapies to help maintain independence. Nutrition support is critical to fight weight loss. And wrapping around all of this is palliative care, which is all about controlling symptoms and planning right from an early stage.
So let's move to the final piece of this puzzle: really understanding the prognosis and the profound human impact of this disease. Okay, so the statistics give us an average, a window of 2 to 4 years after diagnosis. But, and this is a huge but, the reality for any single person can be vastly different. While that average is incredibly sobering, about 10% of people live for a decade or more. And, of course, you have the famous example of Stephen Hawking, who lived with the disease for an extraordinary 55 years.
This chart also gives us a clue about prognosis. It shows how the initial symptoms can be an indicator. Limb onset is generally associated with a slightly longer median survival compared to bulbar onset or the very rare respiratory onset.
And this is a really powerful and maybe surprising takeaway. Even in the face of these immense physical losses, many people living with ALS find ways to adapt and still report having a good quality of life. This is where assistive technology, strong palliative care, and thoughtful end-of-life planning become absolutely central.
And that leaves us with this final, crucial thought that shifts the focus from the purely medical to the deeply human. Given everything we've seen, what does meaningful support for this journey truly look like?